Earlier this week, the Department of Health and Human Services announced plans to reform the organ donation system after an investigation revealed some disturbing collection practices. Investigators found evidence of poor neurological assessments, lack of coordination with medical teams, questionable consent practices, and misclassification of causes of death by an organ procurement program that serves Kentucky, Southwest Ohio, and West Virginia. End-of-life organ donation can be kind of a mysterious process if you haven't ever known someone who has gone through that. So the president and CEO of Donor Alliance, Jennifer Prinz, is joining me now to break down how it works. Thanks for coming in.
Absolutely.
Got to clear some stuff up.
Sure.
Because I know a lot of people are, questioning some things. So how does organ donation in the process work?
Sure. So when somebody suffers an injury and they're taken to a hospital, I think it's really important that people understand. Physicians have one goal, and that's to do no harm, and healthcare teams have one goal, which is to take care of that patient and to save lives. And that's what they're doing. And someone's donor designation status does not play into that fact. So if they're not able to save lives, then they will make that referral to Donor Alliance. That's when our team comes to the hospital and we would talk with the family about donation potential. We would evaluate to see if that patient does meet potential to save another life. After death is declared, and only after death is declared by the healthcare team, can organs be recovered for transplantation. And I think it's really important that people who are watching today and people out in our region understand that.
Yeah, I think, it's good that we're clearing things up, because I know this story has made national headlines. And if someone says, well, I'm afraid to be, a donor or put the heart on my driver's license because, I want them to clearly save my life if something happens, that is what they do. This is just kind of like a one-off situation.
Exactly. People don't know, the healthcare teams don't know somebody's registration status when they're taking care of you at the hospital. They are very focused on saving your life, and that's what the healthcare team is doing. So what people are hearing out on those reports and what you're referencing, those don't match the protocols that are in place by our organization or our hospital partners that are here in our region.
All right, so the HHS says it is planning on reforming the country's organ donation system because of some of the practices. Based on your experience, have you seen any widespread practices that are currently in place now that could be changed?
I think HHS has done a great job of talking about how we need to have reform, we need to have systematic processes across the U.S. We stand ready to help with that. You know that Donor Alliance is a Baldrige organization. We have good, solid practices, and we can help with that. There are other organizations across the country that have those same practices in place, and we can all come together to help make sure that HHS has what they need to put these practices in place.
Why is organ donation so important?
We have 1,300 people waiting right now in our region that need those life-saving transplants. I have seen firsthand how donation helps families who have gone through tragedy see hope at the end of that as they see their loved ones save other people's lives. You know, I'm a donor family member, I'm a recipient family member, I'm a nurse, I've done this work for 31 years, and I'm a registered donor. Our systems are safe and they're ethical, and somebody can save a life. I hope they'll go to donoralliance.org and learn more.
It's so interesting, just having that little heart on your driver's license. It says you can save up to 8 lives through organ donation and can save and heal more than 75 others through tissue donation, which is just incredible. What do people need to do if they're like, I do want to get on the organ donation list so that I can potentially be a match? What can they do?
Yes, when they go in to get their driver's license or state ID, they can say yes and get that heart on their driver's license. They can also go to donoralliance.org and sign up on the registry that way, and they can learn all about how to save a life by checking yes and get that heart on their driver's license.
And it can be, you can be specific on what you want donated and what you don't want donated.
You can sign up for organ, eye, and tissue donation that way.
Okay, awesome. Well, I'm glad you came in to clear some things up, because I know a lot of people have been having conversations about that one story. And, obviously, as you've been saying, even from personal experience, that it can save lives and make a huge difference.
Absolutely. Thanks for having us here today so we can clear up some of those details.
Yeah, thanks for coming in.